This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. PukeNoMo.
You're pregnant for about 8 weeks now, and it's the first time you're going to your OB appointment. If you have questions on what to expect, we have answers in this version of Pregnancy Pukeology Podcast, Episode 17, First Prenatal Visit, everything you need to know in order for your first pregnancy appointment to go smooth. Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop nausea, vomiting, and headaches now. Or just place the NoMo nausea ban on your baby registry for your delivery bag at Bye Bye Baby or on Amazon. And don't forget, they always have something for your little ones, and they are well taken care of with the first NoMo nausea kids ban now available at your local CVS store. Besides giving you that information on your first pregnancy appointment, you may just have this pregnancy humor with our hilarious puke stories, including stories like secret sauce, my hubby knows me better, and fast food, fly food. These stories just may make you want to pee your pants, like you don't already have to pee all the time with these 3 great stories. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind what a baby doctor is looking at when you show up to your very first appointment, the 9 physical exam components inside of your first prenatal visit, and the 10 questions you need to ask to find the perfect provider to deliver your pride and joy.
The science of puke, pukeology.
Congrats, you're pregnant! Now, you're preparing for your first of at least 10 appointments you are going to have. And you're probably going to be as shocked as I was that it's not usually scheduled until about 8 to 10 weeks gestational age. Basically, 8 weeks from your missed period. By now, you've probably already missed a period, taken a pregnancy test, or in my case, 2, find out that it was positive, and you've called your doctor to make an appointment at least a month or 2 out. I was really shocked. I actually ended up taking 2 pregnancy tests and bought the pregnancy test that made it say pregnant or not, because I honestly couldn't believe it. And then when I made that phone call to my local OB, I was shocked that they didn't want to test it themselves before I made an appointment. And my appointment was like a month out. So it was absolutely crazy. So again, if you're sitting there going, why the heck do we have to wait that long? I'll let you know here in just a second. So your first prenatal appointment is going to be your longest. So ladies, throw modesty completely out the window now that you're pregnant and get used to giving blood. Make sure you stay really well hydrated and don't pee before you go, because they will actually ask you to pee in a cup. And that's because of the fact that they want to make sure you don't have any type of urinary tract infections. They also obviously are going to check to make sure that you truly are pregnant, but they're also going to do a dipstick. And a dipstick is a stick of different urinary components that they're testing when they look inside your urine to make sure you don't have anything bacterial or fungal or even little amounts of blood inside of your urine, because all of those things can propose problems for you being pregnant. And again, you being pregnant, we'll have to prescribe you different types of medications in order to move forward. I myself had a urinary tract infection because I had never had one when I was about 7 months pregnant, and believe it or not, it caused preterm labor. So my contractions were getting terrible and I wanted to keep that baby in. So without them doing this dipstick, even though I didn't have the normal signs of it, I wouldn't have known. This is the reason why they're going to always ask you for a urine sample. A side note completely, go buy Careful Catch. Or sometimes your hospitals and or OBGYN visits or appointment areas will actually have it. What Careful Catch is it's like a spoon thing. It holds a specimen cup in your hand so you don't pee all over yourself. Right now, you're probably going, oh, my belly's so little, it's super cute, it kind of looks like a fat roll. But as you get bigger, you won't be able to see your vagina the last 3 months of your pregnancy. So it's really hard. You'll end up peeing all over the place, and it's kind of like a sprinkler system. So this thing is like a really long handled ladle. Again, it's called a Careful Catch. It's awesome. Again, I didn't have it with my first pregnancy. I only had it with my second because I actually do know in the business world, the woman who invented it, she's incredible. And again, we are both champions for each other's products. In the OBGYN offices, again, make sure that you're always constantly washing your hands after giving a specimen or going to the bathroom. This sounds like common sense, but remember, in pregnancy, you have a decreased immunity and you're susceptible to a lot of germs that you otherwise wouldn't be. If you want to know more about illnesses or bacteria that could be hiding in foods, please listen to Pukeology Podcast episode 5, Foods to Avoid While Pregnant. It goes super deep into why you can't eat certain type of foods, what are the actual bacteria and or other substances that could be lying and resting in the food, and why it is unsafe for you and baby. So again, we want you to know that we're here for you. At your first prenatal appointment, you will give your complete health history. Make sure you know when your last period was, your up-to-date shot records, and all surgical history. For some of you ladies, you will also have to make sure you have family history, and if you were ever adopted, try to find out as much as you can about your biological parents, because it can have a predisposition, such as if diabetes runs in your family, you have an increased chance of having gestational diabetes, but usually that doesn't get annotated or noted until right around the 4th or 5th month of pregnancy. Once you give them all this history, you will then do your estimated due date. Once they make this first assessment, it is very hard to change your due date. So if you're like me, I never had a clear cycle. My days would always switch. I would either be long or I would skip months. And it's been that way since I was young when I first got my period. So again, I was untrustworthy with just the period. So I had asked or requested for an ultrasound to find out how far along I actually was. And once they do this estimated due date, they really won't change it unless for some reason you're so far off by like a couple months or something crazy like that. Be prepared to wear a gown. Usually it's 2 disposable gowns, a sheet on the bottom for privacy, and again, your legs will be up in stirrups, and a gown that's open in the front. So again, ladies, I know we want to tie things to the back, almost like, putting your arms through a cape, but instead you're going to actually want the tie to the front because of the fact that they're going to end up doing a breast exam. Your physical exam composes of 9 different components. So the first one is a pelvic exam. Your pelvis is going to be, if you feel the bone, it's like your vag bone, that is going to be your pelvic exam, as well as they're going to be taking a look at your hip structure. Please let them know if you've ever had any type of hip surgery. Let's say that you fractured your hip or something when you were much younger on a horseback riding experience and or in the car. They need to know this because you will then probably be much more of a candidate for a C-section than to try a natural vaginal birth. You'll have a pap smear. Again, pap smear, legs in stirrups, that's that duck-billed platypus. I hope all of you have had a pap smear in the past, but if you haven't, they'll literally take a really long cotton swab and go and swab out your cervix to make sure that there's no form of STD that could be potentially in there, as well as any type of cervical cancer that you need to be aware of ahead of time. Number 3 is going to be your breast exam like we talked about, hence why your disposable gown is going to be in the front. Now this breast exam, they're also going to take a look at your nipples too. And it is important to talk to your provider about breastfeeding once you get a little bit further along. Because some of us, like my son, was not a very good latcher. So I actually had to use these things called nipple guards. And what it did is it helped to pull my nipples out, and so that it would help them to latch better. So if you are interested in breastfeeding, again, La Leche does a wonderful job, and or any of the other type of breastfeeding information that you can find out there. Blood work. Blood work is the most important. It will actually give you the detailed amount, or I should say how far along you really are in pregnancy, due to a hormone called HCG, human chorionic gonadotropin hormone. This is a hormone that is created. This is the hormone that when you pee is what reads the stick. So again, in the blood work, we can see exactly how much. This is also really important if your blood work is stating that this HCG component is 3 to 4 times the normal amount. Unfortunately, you could be having what's called an ectopic pregnancy, where the egg itself is actually inside of the tube and is not fallen into the uterus. So that is something that has to be surgically removed, and it is considered an emergency. I'm not trying to scare you. I'm trying to give you the real info on what pregnancy is all about, ladies. You will have a pregnancy test, peeing again, and then your urine screen. They're taking a look again at protein in the urine, and also sugars and sugary components. Again, we want to check to make sure that you don't have any gestational diabetes. Your blood pressure, your medical assistant will usually check your blood pressure, because we do need to take a look at blood pressure every single time. Preeclampsia is one of the most common conditions. It is a hypertensive or high blood pressure situation that is caused by the baby. As soon as the baby is delivered, no more high blood pressure for you, as long as you don't have a primary case of high blood pressure. So we need to keep watching that, because that can be a true emergency at delivery. We want to take a look at your weight to make sure that you are adequately weighing appropriate, so that we can track your pregnancy progress, not just the size of your uterus when growing, but also we want to take a look to make sure that, again, you're not gaining too much weight, because that can be just as dangerous. If you want to know what is the appropriate amount of weight to be gaining, go ahead and take a listen to Pregnancy Pukeology episode 12, Pregnancy Weight Gain. It gives you all the facts on how much you should be gaining, whether you have one baby, twins, and or where you start to where you finish. And then the last thing is possibly an ultrasound. You will only have an ultrasound needed if you are having pain, bleeding, or underwent fertility treatments. I myself requested an ultrasound because I did not know that I was pregnant when I was. And just give you a little heads up, with my son, I was on birth control pills. So when I went there, I hadn't had a period for over a year. And guess what? I found out I was 4 months pregnant. And let's just say that was a very short pregnancy for myself. I couldn't believe it. I was literally flabbergasted. Don't forget, your birth control pills do not work if you take antibiotics. And as a physician, I should have known better, but I'm just sharing that story to let you know that we are all human and it happens, but he is handsome. I love him to death, and he is the best thing that could have ever happened. Best oops, I should say. Now, finding your perfect doctor is another task. And I should say finding your perfect provider, because there are doctors and there are also midwives, and you'll hear of people also called doulas that will help you out during pregnancy. So you're going to want, if you want to see a doctor, an obstetric gynecologist, which is shortened as OB/GYN, the OB for obstetrician and the GYN for gynecologist, is a physician, is a doctor that specializes in pregnancies and deliveries. If you live in a rural area, your doctor, your primary doctor or family doctor might actually be the person who will be delivering your babies. But an OB/GYN is specialized in babies. They've done 4 years of residency where that's all that they have done. And they specialize in both regular normal pregnancies and high-risk pregnancies. Now, if you're super high risk like I was for my daughter, you will see a perinatologist, which is a person who is taking a look at the health of the mother and the baby as a subsec, just even further subspecialized, because there are some situations, like myself, when my son was born with IUGR. It is a condition where he was very small at birth and they couldn't figure out why, so they wanted to track my daughter a lot more. You will be seeing this provider or doctor for 40 weeks. Yep, that's 10 months. So whoever said that pregnancy is 9 months is lying. So you better like them, like the group, be okay with the wait time that you have at their office, and be okay with their staff. So it's really important because, again, you choosing them is just as important as them choosing you, because there are options. So again, we will talk about a series of questions in the next set, but I do want to talk about the difference between an OBGYN, a physician, and a certified midwife, a CNM. An obstetrician gynecologist and OBGYN is a medical doctor that went to school for 4 years of medical school, followed by 4 years of residency. And this is all after, obviously, 4 years of an undergraduate education. They are trained to deliver all different types of birth, even high-risk pregnancies. Physicians still deliver the most amount of babies across the country. Again, in some hospitals that have midwives, they still notice about 74-75%, about 3/4 of those that are delivered by OBGYNs, while the other midwives have delivered the other 25-26% of uncomplicated births. Notice what I said, uncomplicated. A midwife is a nurse. So to become a nurse, you can go either straight into school, so from high school, and get your 2-year degree, or you can actually get a 4-year degree at an undergraduate level. And once that happens, in order to become a certified midwife, you do have to go through a graduate program to become certified. Again, the length of time is all dependent, but a certification is needed. So if you think about it, the difference is very extensive. You have 12 years where an OBGYN is certified, and then as a nurse, you could either have anywhere between 2 to 6 years of training, depending, as a certified midwife. The choice is yours as long as your pregnancy is normal. And nurse midwives are usually more advocates for natural birth, but that doesn't mean that they will shy you or move you against having an epidural or having any other types of medications. I'm just letting you know that usually from the naturopathic feel, a naturopathic type birth rests in the hands usually of midwives. But again, rest assured that OBGYNs are always going to be the backup for a certified nurse midwife. They're always on call at the hospital or at the area that you do choose a birthing center, because sometimes things happen and they happen very quickly. So you want to know who it is that's going to be delivering your baby, and don't have that be the first time that you meet them. So ask your midwife, if you do choose one, who is the backup physician? I would like to meet them, him or her.
Throwing up on a Tuesday? One puke story.
I was laying down and I told my boyfriend, come over here. Now, I was recently pregnant and I wanted to tell him a little something, like a secret. So I leaned up, and just as I was getting close to his ear, I puked everywhere. I tried to have him and myself jump back in time, and unfortunately, he just got chunks all over the side of his face. All I wanted to tell him was happy anniversary, and I was very excited we were having our first baby. That did not go as planned. I just have to say, Amelia 111821, thank you so much for that hilarious story. I'll never think of a secret the exact same way. My first and only puke story in pregnancy is this one. I had just finished complaining so that all my symptoms had just disappeared. So I'm worried that there's something wrong. My husband rest assured me that all was well, but I got upset because I know my body and I know when something is off, and if everything disappears, something has to be off. So I was getting ready to go meet him that night, and I was in the bathroom brushing my teeth, thinking of how annoyed I was that he thinks he knows me better, and then bam, puking all over the sink, on my new toothbrush. It was absolutely everywhere. Of course, I cleaned up the sink very quickly, and I never told him. I guess my hubby does know me a little better. Miss Muggs 21, and that's spelled MISSMUGZ 21. Thank you so much for that hilarious puke story. I wouldn't tell my husband either, because, of course, wife always knows best. Oh, I got one I just remembered from a friend. So my friend was pregnant at the same time I was, and I had morning sickness, but was in the car, and all of a sudden they couldn't pull over. So we had just gone to McDonald's, and there was a fast food bag. I really rushed to try to grab a fast food bag, and all of a sudden I puked all inside the fast food bag. So much so that I thought the bottom was going to fall out. Her dad couldn't stand the smell of it, so he made her throw it out of the window, assuming it would just fall on the street. But instead, it flew and splattered all over the person's car behind us. Oops. Connie Talbot fan, CONNIETALBOTFAN. Thank you so much for that hilarious puke story. If you have a hilarious puke story that you just can't wait to share, please send it to me at pukeology@nomonausea.com. Again, that's pukeology@nomonausea.com, or just tweet us at pukeology, PUKEOLOGY, so we can all have a good laugh.
Tips and tricks to stop the chuckle that you need.
Most of you ladies are probably wondering, who is actually going to be delivering my baby? By this time, you have met the receptionist, spoke to your insurance liaison, met a medical assistant who has taken your vital signs, including weight, blood pressure, and asked you when was your last period. And now you're sitting in a patient room with a hospital-type gown on, wondering, will I ever see the doctor or midwife? Yes, of course you will. You need to be just as prepared to find the group or solo practice provider who will be delivering your baby that shares with you the values that you want to uphold. So here are the 10 most important questions to ask, and come in and ask them, even if these are the receptionists or the other people, because again, you want to make sure that all of your questions are answered. This is the time to ask them now, because once you choose them, you're kind of in bed with them, because you will be paying them a hefty amount to have that baby. Number 1, do you accept my insurance? Ladies, it is very important. I will tell you from a personal experience, my insurance for the family in working for the hospital was over around $7,000 or so, $8,000 maybe per year. And then on top of it, I ended up paying over $12,000 out of pocket for the delivery of my healthy baby girl. So I'm going to make sure that you guys take a look and read over your insurance policy. See what's covered. Make sure that a breast pump, whether it's manual or electronic, is covered. Talk to them and find out how much out-of-pocket expense once your max is met. I had a maximum $5,000 deductible, which I thought after $5,000, that's all you pay. Wrong. You pay then 20% thereafter. Again, I am no insurance person. I'm just telling you as a patron and as a female who's had a baby in the past, 2, may be exact. Make sure that you take a look at yourself and your significant other's plan, because one of you guys might actually be better. And so switch to the one that's going to save you the most amount of money during this pregnancy. Make sure you do it before your first prenatal checkup, though. Again, if not, it's a whole mess. Number 2, how many doctors are in your group, or are you a solo practice? If you're a solo practice, who covers your deliveries when you're on vacation? And can I meet them? If you think it doesn't happen, it does. My favorite doctor, who is actually a family friend in the group that I go to, was on vacation for both of my deliveries. I literally texted her when I was in delivery and she goes, "You won't believe it. I can't believe you ended up having the baby again 3 weeks early, just like the first one." She took her vacation a month early to make sure that she would be back in time to deliver my babies. And guess what? Boom. She was still there on vacation, and another colleague of mine ended up delivering. But again, it was amazing. And I have both of my beautiful babies that were healthy and uncomplicated. So another thing is, check out your friend's scars. I know that sounds super crazy, but yeah, have a scar party. Go and ask some of your friends who have had C-sections to see who was in their group, who did the delivery, and what it looks like. I have to say that I did have an emergency C-section with my second, and gosh, you can't even tell. I can wear a bikini, and most people, a fat roll looks even worse. So again, nobody even knows that I've had a C-section because they did such a great job, and they did stitch me instead of doing staples. But there's a reason for one or the other, and we'll cover that at a different time. Number 3, which hospitals are you affiliated with? Where will I actually deliver? And is that hospital on my plan? A lot of times OBGYN groups will cover, let's say, 3 to 4 hospitals, multiple different people within the group because they have different offices that they go to, but your insurance will only cover one hospital. If you do work for a physician, let's say a hospital setting, a lot of times they're going to want you to deliver at that hospital that you work at, and you get incentives like a decreased amount on your bill for working at the hospital, or again, maybe you work for the anesthesia providers and then your anesthesia costs will be waived. All those things are to be considered. How many babies do you deliver a month? What's the ratio of vaginal births to C-sections? You want someone experienced in both, because about 1 out of 3 babies are born via a cesarean section, according to the 2017 Consumer Reports. That means you have a 33% chance that you will have a C-section. Even though, moms, I know that we never think about the emergencies and, woulda, coulda, shoulda, but it happened to me on my second one. Again, things happen, they got to get the baby out, it becomes an emergency situation, or if it's for the best for mom and baby, they will opt to do that as well. Remember, you can't stay in labor for 24 hours. How many patients' appointments are scheduled in a day? This is important because your time is your most precious commodity. How much time do you allot for each of these visits? Translation: if you don't want to be in the waiting room for hours every single time you have an appointment, ask those 2 questions, because it's really important. If you have a chatty Cathy physician, they may have amazing bedside manner, but do you really want to wait for 3 hours every time you have an appointment? And by the way, ladies, at your last 2 months, you're there almost every week. What are your after hours policies? What's the best method to reach you, or reach the doctor, or reach the doctor's nurse, or reach the doctor's nurse medical assistant? Is it by phone, by email? Is there a nurse hotline that provides advice and answers in between visits for pregnancy emergencies? Number 7, where are you in views about pain medication, natural childbirth, epidurals? Formulate your birth plan. But understand that things don't always go as planned. And modern medicine isn't a bad thing. So stop all the misconceptions and get well informed. Since this is my personal wheelhouse, I promise I will do an entire podcast on the truth behind epidurals and spinals and medications that are assisting with birth. Number 8, do you perform vaginal births after C-sections, also called VBACs? You want to keep congruency when you have pregnancies. And let's say you do have an emergency C-section like I had. If I were to have another baby, again, this is a question that I wished I would have asked with my first, because a VBAC means that you're going to try to do a natural birth via the vaginal channel, even after the abdominal muscles have been cut. It is more dangerous, but there are some groups that specialize in them. Other groups say, no way, no how, and they won't do it. And if you had a C-section the first time, you're going to have C-sections each and every time with this group. Also, what's your VBAC success rate? Again, even though you do it, if you're not successful at something, again, you have to make sure that you find a provider that is very successful. And again, I will try to make sure that when I do talk about epidurals and spinals, we'll discuss VBACs in a completely separate podcast. Number 9, do you have experience with high-risk pregnancies? That is the most key that you can possibly ask. And this will determine the difference between if you have a midwife, a certified nurse midwife, or if you choose a OBGYN or a physician. Physicians are able to handle high-risk pregnancies, whereas a midwife are not. They will only be able to handle normal, natural, I say natural, but I mean normal deliveries, vaginal. Are you comfortable working with a doula? If I decide to hire one, that's question number 10. A doula is someone who is going to be your patient advocate during your pregnancy and after. There are many different types of doulas. You can find people who will help you almost be like a nighttime nanny thereafter. So again, doula is just someone who knows what your wishes are. And even in the heat of the moment, sometimes we have a way of changing our birth plan. A doula will make sure that that is exactly what you want. And if something you are hard, steadfast on, let's say for example, you're a vegetarian, you refuse to eat any type of meat, even though that you want to just consume an entire cow because you're pregnant and you're craving it, a doula will be the person that says, no, this is your core belief system. I'll go get you, some nuts or something that has other form of protein in it. Once your first checkup is out of the way, the only difference between the first one and the 8th one, between 26 and 36 weeks of pregnancy, is that they will, number 1, listen with a Doppler. They'll also make sure that they can hear the baby's heart rate with a Doppler. And we'll talk about more what a Doppler is. It's just a different type of ultrasound that transduces sound waves by having you listen to the baby's heart rate. And again, it's something that's a little tiny tool, very interesting for them. And it's the greatest thing for you to hear your baby's first heart rate. Number 2, measure your fundal height to check the baby's growth. The fundus, again, is going to be the area that's farthest from the opening. That indicates how big your baby is. So again, think of the top of the pubis, and once you're growing and growing, it kind of comes up, and it will actually come up above where your belly button is at some point in time. And number 3, an ultrasound nearing towards the end to check the baby's position. Whether the position is vertexed, whether the position is breached. Again, breached or frank breached is when the baby is the wrong way. So the right way is head down and we're good, right? Head down, think of it head down, face down. So again, head down is in the right position. You also want to make sure the baby is not posterior. I know all these words sound really crazy, but again, you'll kind of start to hear them over and over again. The uterus is the organ that houses the baby itself. Now, we talked about the fundus, which is the actual opening that they will be measuring to see if you're measuring appropriately. A Doppler is that ultrasound that hears sound waves so you can hear the baby's heart rate, whereas a visual ultrasound uses the same type of sound waves that are emitted through that little machinery, but then they translate them into a visual picture by what bounces back. This is also how animals like bats that are blind can see using sound. So it's using that same exact technology. So I've kind of let you in on what to expect. You already now know the behind the scenes of your first prenatal checkup, the questions you should be asking to find the right one, and the education on what is expected. So there's absolutely no surprises. Have a wonderful journey while being pregnant, and I'm excited to share it with you. If you love Pregnancy Pukeology Podcast, let us know with a 5-star rating or likes for hearts. Don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks for listening to Pukeology Podcast in Pregnancy, Episode 17, your first prenatal visit, everything you need to know in your first pregnancy appointment.
Pukeology Podcast, Edutainment at its finest.